Today I'm here with Nancy Hunter and her support person Samantha and little Reese. And Nancy is a patient of the pain clinic at Cumberland Regional that's been closed since September, not seeing any patients. And we have two amazing physicians that were running the pain clinic, Dr. Dan and Dr. Justina Krolos. And sadly, many patients have been without proper treatments since September. It's causing a lot of duress and pain and suffering. And today I want to introduce you to Nancy and give Nancy a chance to say what has the impact been on her life since the pain clinic's been closed. So Nancy, can you share with us what, and everyone that's listening today, what has this meant for you personally?
It just brought me back to the last time I was there and thinking about when I left that day, being told what was going on and that things were closing. And I left kind of laughing because I thought, there's no way this is going to stand. Like, I thought if they close it all, it'd be short-lived and it would be reopened because of the impact. I never imagined that it would actually stay closed. Like, because it just seemed absurd, I guess. And so I was laughing because I just was like, oh, I'm not worried about it. See you later. Right?
You just assumed that it would get back open.
Yeah.
Yes.
If it closed at all.
Right.
At that point. Because that was August was my last appointment. Okay. And anyway, so it took me a while before I started to really settle in with the idea that it wasn't going to reopen. And since then, I feel like it's changed my whole, it's changed my whole outlook on life. For me, it started in my family doctor's office, who's really great, but we were talking about my medication that Dr. Dan Stojanovic prescribes, and it's methotrexate, which they often use as a cancer drug, and it's an immune suppressant, so it stops my immune system from attacking my organs, essentially, or slows it way down, and takes my functioning level from almost completely bedridden to to being able to at least get around my house and get out a little bit. So when she first started talking to me, she said she can't prescribe this medication for me. And she made referrals to a rheumatologist in Truro and to the Halifax Pain Clinic, which means for me, several years of waiting before I even see anybody who might prescribe this drug to me. So that was probably, I would say probably in November. And so now every time I see her, she's preparing me for what's to come, rather than, because she doesn't have a choice, it's not her fault, but rather than, okay, what are we gonna do? Or like, what can we do in this moment? It's like, okay, Nancy, like, are you ready for this? Like, when, they run out at the end of April, have you set things up, or, what's gonna happen? So I essentially am not going to be able to hold my own silverware. Before I had methotrexate, my mom, who's a retired RN, and my son were staring at me in bed, and we were talking about if I was dying or not, because we didn't know what was going on then. And sorry. That's where I'm headed back to.
We need to make sure that doesn't happen for
Sorry.
you. It's okay. I'm sorry too.
It's not a place anyone should have to live. I sleep almost 20 hours a day. I can't in any way take care of myself or anybody else. To me, it really is. It's like saying I'm not going to give cancer treatment to somebody with stage 4 cancer. Like, and so without this drug, I'm going to lose most of my functioning. I will hardly be able to walk. Again, not hold silverware. I won't be able to shower on my own. I'll sleep most of the time.
So Nancy, you're scheduled for your next treatment in April?
It's a medication I take weekly, and I run out in April.
Okay.
And then I have nobody to refill it.
And he can't re-prescribe it?
Not that I'm aware of, because in order for me to have this drug, somebody also has to monitor my blood work. Right. And other things, and I don't know all the ins and outs, but it has to do with white blood cell counts and red blood cell counts, and so in order for, he can't just prescribe it and walk away. Right. Somebody has to monitor it. Yes. It's not a drug that's given out freely. Yeah. And so you have to qualify with certain diagnoses, or in my case, because I didn't have the right diagnosis, we spent 6 months to a year tracking my reporting, blood work, and other data, so that he could justify giving me the medication in the first place. Right.
And you don't want to start all over again with a new physician, right?
Not only do I not want to start over, but even if I did, I have to wait several years to get to someone who would even do that. Right. So without this pain clinic, I'm going to spend, several years waiting, and then maybe several years, or another maybe 6 months to a year, if I find the right doctor who's kind enough and compassionate enough to listen and do the work that Dr. Dan did. Right.
So tell me about Dr. Dan. I think what's important to point out to the public is that we have a situation here where we have two physicians, Dr. Justina Krolos, who is an anesthetist who has specialized in pain treatments for over 17 years. She's has the highest certifications in the whole country. And we have Dr. Dan, and he has also done a lot of extra training in the area of pain management. We have two physicians that want to provide treatments and continue the service, but I'm not privy to all the details, but my understanding is Nova Scotia Health what led to this is that they wanted to move the physical location of the pain clinic out of the perioperative area, which would mean the doctors don't have the support of emergency measures and nurses to support them in the event that treatments, because the treatments there are risks. Yeah. So that's very frustrating, I think, for the patients, for you. It's frustrating for myself and for everyone that knows. We have doctors. The issue is that we don't have the doctors. We have the doctors.
And we have doctors who live here specifically for this reason in a place where we can't get doctors. Right. Yes. It doesn't make any sense.
It doesn't make any sense. We've all tried to better understand this, and there's no good reasoning. So can you tell us a little bit about, Dr. Dan?
Can I? Yes. So can I do two things? Because I this is really bothering me as well, is that they've recently announced this ER expansion. Yes. And I'm like, okay, so you have money to expand this ER and put in all these great things for a place that doesn't have enough doctors to serve its current ER, yet you can't house the pain clinic who has doctors here or add them to your plan. Right. It makes no sense. It's like, to me, it was like a slap in the face when I read that in the news. I just thought, like, what? Like, you can't have the pain clinic, but you can do this? Yes. And you can add dialysis in there, but you can't add the pain clinic? Right. Yes. Like, it makes no sense to me at all.
All wonderful things you can have.
It's almost like people that are suffering with pain, it's almost like that isn't being recognized as an actual medical condition and a problem.
Well, yeah, so we'll talk about that too, because what are they going to do with me? Because I'm going to get to the point where I won't be able to stay here. So I'm going to end up at that ER. And what are they going to do with me? They're aren't going to have a specialist there to treat me because they're not allowed because there's no pain clinic, right? Yes. Like, I'm going to be in that hospital eventually with no treatment and nowhere to put me.
when there's no need of it.
And there's no need of it.
It's
And
preventable.
it's going to cost God knows how much money to take care of the people like me who are getting treated and staying at home. Or
So
were getting treated
I
and
was told
staying at
that
home.
there's 3,500, so 3,000, over 3,000
Yeah.
people that have gone to this pain clinic from around the Maritimes. There's
Mhm.
people from here in northern Nova Scotia, but there's also people from New Brunswick, PEI, and other parts of Nova Scotia. And I tabled a petition with over 800 signatures the last legislative session, and right now there's an online petition with over 900 signatures. So your voice is representing many thousands of people, and I'm so sorry this is happening to you.
Thank
But
you.
I am committed to doing my best to having your voice heard, and it's people like you. You deserve care.
Yes.
Yes. So, what else would you like to say?
Well, so I guess I went away from it a bit about part of your question was about Dr. Dan. My health journey has been a really long process and difficult process to get to this pain clinic. When I first started to get sick, I worked as an autism support worker at mental health, and I say first get sick lightly because it took time to get to there, but got to the point where I was no longer capable of doing that job physically. And so I went off briefly at that time for about 6 months, and during that time did a whole bunch of health programs, especially physio, but in particular went back and did my master's because I didn't want to stay home. I didn't want to not work.
Right. What did you do your master's in?
Counseling psychology.
Wonderful.
And so I went into child therapy at mental health, and eventually over several years couldn't do that job either. So I've been off work for 5 years. And in all this time, I have seen, I don't know how many specialists in our healthcare system in Halifax, and trying to figure out exactly what's wrong with me. I have talked to countless different professionals, and it took probably almost a decade to get from starting to end being getting into Dr. Dan's office, and it was a nightmare. And I went in there that day, and I'll never forget this day. I went in ready to explode at this human, whoever it was. I remember saying to my mom, if he does not listen to what I have to say, or if he tells me that this is about something that's not rational, or he can't do anything, see you later, I said, I'm going to unload on him. And I walked in with a major chip on my shoulder. And as soon as he walked in and sat down, I thought, uh-oh. And because I could feel my resolve, because here's this like little cheeked young kid.
Just for clarification, he's not a kid.
He's not. But in my mind, I was like, oh, like he's just like this cute little kid, and he looked so innocent, and he's smiling.
He's so refreshing.
He is, and so, but I'm wanting to lose my mind at him. So I'm like, you can't be a cute kid, but I still was like, kind of like I was being hard. I was like.
You were so frustrated.
Yes. And within probably 10 or 15 minutes, I just breathed, I just went, and I let out this breath of air because he sat and he listened. And I knew within minutes that he was listening. He had read my chart. Imagine the surprise I had as someone who works in the healthcare system, that somebody read my chart before I walked in their office. Was just like, oh, thank God. And he blew me away that first day. He had thoroughly read my chart. He had questions. He, instead of getting me to start from, scratch and start talking, he told me all the things he already knew about me. And just the relief of knowing that he had read this chart when I knew a lot of them hadn't. He put me at ease. And I'm sure within a few minutes, I was smiling back at him and talking to him. And
how long has he been providing treatments that have been helpful to you?
So that was in the fall of, I want to say probably 2022.
Okay.
And we had to take about 6 months or a year to do some tracking, collect data, both with my reporting, which I really wish I could go back and show other specialists. Like, it was 100%. I would report symptoms, he would do blood work. We did some blind drug trials where he would give or not give a drug and I wouldn't know, and I'd come back and report on what my symptoms had been, either it had helped or not helped. My reporting was bang on with everything. And so we did all this tracking and tried a couple of different things, and then he was able to justify giving me this drug because I don't have the diagnosis to have it.
Right.
But he could justify it because we'd done all this tracking. So within
And it helped.
6 months to a year, I got the drug and had instant improvement.
Wow.
I went from being basically not functioning to able to get outside again, able to start driving again, able to go to the beach. That first summer was probably the best summer I'd had in 10 or 15 years.
Wow.
Because I was still off work, but I could go to the beach and go swimming.
You could live.
Yeah.
Quality of life.
I couldn't, so that spring I tried to go back to work, not because anyone asked, but because I wanted to. And I wasn't able to stay to make it sort of back to work. I wasn't able to get functioning enough to live and get to work. But I was able to enjoy myself. Yes. I had joy again.
Some quality in your life.
There was quality,
real
quality, right?
Everyone deserves.
And coming off of being bedridden, it was pretty significant. Like, it changed my life for the better. And the whole way through, he would problem solve with me and collaborate with me. And I always knew he was listening. And not just listening, but taking my information and using it with his knowledge to come up with answers and solutions and figure things out.
So just to clarify to anyone listening, Dr. Dan and Dr. Justine McCrossin are two doctors that are still in our community. They are still practicing, but not able to provide the treatments at the pain clinic that they had been, due to the changes that Nova Scotia Health Management have decided. So obviously, we want Nova Scotia Health Management to listen to the patients and to listen to the physicians who are the experts of what they need to have in order to practice medicine safely and provide the treatments. Samantha, did you want to make any comments at all? No pressure, but...
Oh, I never even thought to prepare. I just think it's absolutely absurd that it's still closed, and it's going to put a huge pressure back onto the healthcare system. I think it's going to make it worse. We also, I come from the home support background. There's not enough of us now. There's not. And it's just going to get worse, let alone the things that, this, I feel like the pain clinic closure is, I'm trying to think of the right word for it, but it's negligent towards harm reduction. Not only that, the addictions that are going to come out of this.
It's funny you said that.
It is, the addiction.
So we want the pain clinic reopened.
Yes.
Now.
Yesterday.
Yes.
And I know that you speak on behalf of a lot of patients. I'm going to have an opportunity to speak to a few more. But I want to say thank you. I know this hasn't been easy. And thank you for your willingness.
Thank you.
And desire to share. Is there anything else you'd like to say before we close?
Just that, I guess, like Sam was saying, it's negligent. It's unethical. Whatever they need to do to open it, they need to do it. Yeah. It's not, I said earlier, like, nobody would take away somebody's cancer treatments and say, sorry, you have to wait several years for this.
Yeah.
They wouldn't. Like, if you have stage 4 cancer, you can't wait. Well, I'm about to be stuck in my bed. I can't wait.
Yeah.
I'm not, like, the idea of having to wait years on somebody's wait list to see if I might find another doctor that actually listens again, which I have to be honest, in my experience, is mostly not likely. I mean, there's
Your example in comparison to cancer care is a good one. Like, think about if a cardiologist said, or let's say Nova Scotia Health said they were going to close down the area that they do cardiac caths and said you have to put stents in a different area without the medical supports, and the cardiologist said we can't do that safely, and everyone stopped getting stents put in their heart to keep their
or put on wait lists for several years till they maybe
that
appear.
would, like, so why is pain treatments for pain being treated differently?
And I think you have to think about why are we in pain? My immune system is literally going to attack my organs. So I'm not going to die in a month, but without meds, essentially, my organs are going to eventually slowly shut down one by one.
Yes.
It is a killer.
And your quality of life will not be there. So so we're all in unison and unified with get this pain clinic back reopened, and I will do my best to have your voices heard.
For sure.
Okay, thank you.